Hello, gentlemen. Today
Hello.
we're going to be assessing your health risks and medical information in order to determine if you qualify to be tested at the submaximal and maximal level.
Okay.
Before we start, you're going to have to fill out a form of consent to be here, just saying that you're willingly here to be tested.
Hold on. Okay, I'm waiting.
Now, if you could look over the family history, personal history, and symptoms, we can go through them together. And for any yeses, just check yes. And okay, what did you start out with?
Okay, I have a family history of heart attacks and
Okay.
strokes.
All right. And for you?
I don't have any of this.
None?
No.
And personal history.
I have high blood pressure, high cholesterol, and asthma.
Okay. And for you, Enrique?
I only have high blood pressure.
All right. And for symptoms?
I have chest pain, shortness of breath when I work out, heart palpitations, I get dizzy or faint constantly, I snore loudly, and also suffer from back pain.
Now, there are three categories of risk factors. A low risk category is classified as men and women who have two or less risk factors. Moderate risk will be two or more factors. And a high risk is an individual, on the other hand, that will be classified as having a known cardiovascular, pulmonary, or metabolic disease. And additionally, there are major signs or symptoms that may suggest these diseases can occur. Now, if you look them over in figure 2.3 on page 21, we can go through these, and as you said, Ivan, you have listed a few of those. So immediately, according to the American College of Sports Medicine, you will be placed under high risk. I believe one of them you mentioned was pain in the chest,
Yes, when I work out.
palpitations, and dizziness or syncope.
You think it has anything to do with my drinking and smoking?
It does. It does have to do with your drinking and smoking. And Enrique, you did not have any of these because you only listed high blood pressure?
Yeah, just high blood pressure.
Okay. Well, now let's get to your lifestyle habits and see if we can get down to the bottom of this. If you have any uncomfortable or shortness of breath during exercise, then you should click yes. Ivan?
I do have, yes.
Okay. Enrique, you don't have to worry about that. And just take a look at the rest of these. Any yeses, just click yes, and then we can go through those.
Okay, well, I click yes for chest discomfort during exercise. Every time I start jogging, I feel a chest in my pain, and it does go away once I stop. I do smoke cigars for the past 5 years, about one cigar a day. I never tried quitting, and like I said, I smoked for about 5 years. I drink about 24 cans of beer a week with about 5 drinks of hard liquor.
Okay.
And I also like to drink about 10 cups of coffee a week as well. And as for activity level, I have a desk job, so I do not move at all. I don't exercise on a regular basis. And I'm basically here so I can maybe try to get a little bit better in shape. My friend Enrique here kind of told me I'm out of shape, so I should probably start getting in shape.
Yeah, you should probably listen to him.
Yeah.
Well, Enrique, how about you?
I don't have any chest pains or discomfort when I do exercise. I currently don't smoke. I haven't quit because I haven't started. I do drink occasionally. I drink about maybe 10 cans of beer a week.
Okay.
Which is way less than Ivan.
Yes, it is.
I do drink caffeine, but it's mainly soft drinks. I don't like coffee. I don't drink that much tea. I have a pretty active lifestyle. I work construction five times a week, normally, for about like 8 hours a day.
Okay.
And yeah, other than that, I don't really do much physical activity because construction I feel like is enough.
Mm-hmm.
And yeah.
Do you have any goals or objectives?
Mainly lose fat, just cause of the meals I eat aren't the healthiest.
Okay. Well, since Ivan, you are in a high risk category, you are advised to get a medical examination prior to doing any of the testing that we will give you. Now, Enrique, since you are low risk, you do not have to do any of the medical examinations, and you'll be good to go and do the testing right away.
Alright, sounds good.
Alright?
Darn.
It's okay.
And cut.
And cut.
That was good.
It was.